thing. When you when I first went into this market, there was a real resistance to any kind of discussions about patient experience. And it was really dismissed, but you would go into the waiting room and you would see a lot of people waiting in these hospitals, sitting around waiting on a registration person to manually put in their information and people writing on paper clipboards. But then you would also see that, and you would talk to the CEO or the CFO or the person who's in charge of a patient registration, and you would have conversations with them and they would say, our patients just don't respond to mobile. They're not very tech savvy. And you're like, but I just walked through the waiting room and I saw a lot of people on their phone. Waiting room had a mobile phone and they were on it while they were waiting to be seen. And you had a big backlog of patients. And when the pandemic happened, they were forced to confront that and they were forced to start to deal with patients in a new way because they couldn't come and sit in the waiting room. And so slowly but surely, there's a realization that they had to start to deal with the patients in a new way. And so there started to be a realization in even in the rural market, which I think is really the last mile, that this is possible. And so there's started to be an acceptance, but I think we're still in the show me state to a degree that in this market that it's going to work, but we are there, and things like getting your bill over the phone through a text, those things are starting to be pretty universally accepted. I think there's still some reticence on behalf of management, but they're starting to get it. And I think we're starting to get there. It's still not quite as, uh, they're still not quite as on board as I'd like to see them, but we're getting there rapidly.